Makarios Hospital is the tertiary service for respiratory diseases on the whole of Ireland. With the initiative of the Breathing Life Trust, we managed in 2009 to set up this whole center, this new wing for the management and care of respiratory diseases in children. The cases that we deal with here at the center are covering the whole spectrum of respiratory disease in children, starting from the very common, like the conditions to do with asthma and respiratory infection, and also going to the more rare and difficult cases to do with cystic fibrosis, bronchiectasis, rare syndromes that are sort of involving the respiratory system, genetic syndromes, and so forth. We started in 2009 with 3,300 cases per year, and in the last year, 2013, we exceeded the 6,000 cases. The team now has grown. There's a second pediatric respiratory physician here working with us with the setup of the center. We have a specialized nurse that is been sort of looking after our patients and having the link and the contact with the families in their everyday life for every issue and problem that they may encounter. And we also have put together other disciplines like the nutritionist and physiotherapists for respiratory diseases that is linked to us now and sort of developing an expertise in the field of respiratory disease physiotherapy. Another field that we have managed to develop over these years that the center is working is the research direction. And we have managed to publish a number of papers in peer-reviewed journals in the last years. And we've been quite successful in gaining competitive research money for projects that we're doing here. We very recently been awarded an FP7 EU grant on the study of rare diseases of the respiratory system here in Cyprus, together with other European countries. And we have now hired a doctoral student that he is working on this field now. Actually, this expertise has made the center to be acknowledged not just for the care of this rare disease, which is called primary ciliary dyskinesia in children, but also for the adult population. The families and the patients have a very close contact with the unit. They are very sympathetic of our work, and we really see acknowledgement for the work that the unit and the center is offering in every step of our life, and this is really rewarding. The strengths of the unit and the research that is doing and the service that is offering has put us into the center of the services that you offer to children here in Cyprus. What we can do best is to bring people and disciplines together and strengthen those links and get more specialized areas of care coming together here. I think this center will continue to improve and gain more acknowledgement in the society of Cyprus and the region. We as health professionals would like to thank the Breathing Life Trust for their support to the great cause of creating this lung center for children. But we also like to thank them on behalf of our patients and their families for the service that we manage to provide to them through this support. If it hadn't been for this donation of the Breathing Life Trust, this wing here, which is a real whole wing, would not have been established and would not have the potential that we have today. We'd like to thank you.